This is a newborn baby born freshly from the womb. This is exactly what happens when a baby is delivered. See, take a look at the mother's placenta. This is the placenta from the mother. Let me cover my baby because I don't understand some of them before I go carry bad eye, they watch my baby. See, let's take it that this is the mother's placenta. This is usually the part that is attached to the mother and the side that gets to the baby. Are you seeing this blue mark here? This is the vessels where the baby is sucking everything from the mother, like the nutrients or whatever thing they need to survive. These are where the babies are getting it from, and this runs directly to the baby. So let's take it that once a baby is born, they usually cut this part, but before they cut this, they used to consider a whole lot. They will first of all take a look at the baby. They don't just rush and cut this, because sometimes when you see that the baby is not responsive, like their color is not showing that they are getting enough oxygen, they usually wait before they cut this placenta until they stop feeling pulsation, because once a baby is delivered, you will notice that this place will still be pulsating. That is kind of breathing. So, but once you notice that there is no more pulsation, that is the best time to cut this cord. But in all, they usually watch the baby's appearance to see if the baby is pinkish. Like you can see that this baby is quite pinkish. It shows that the baby is getting enough oxygen. But if they notice that the baby is bluish or not getting enough oxygen and the cord is still pulsating or breathing, they usually leave the cord with the baby and start stimulating the baby until they notice that the baby is getting enough oxygen or responding to the external environment. You know, once a baby is born and you cut this, it means you are telling the baby it's time for you to be independent and start doing things by yourself. Unlike when you are still attached to this placenta where you are getting your oxygen and everything. Right now, it's time for you to do this by yourself. That is when they start watching the baby to see if the baby can cry, because crying of the baby indicates that the baby is ready to adapt and he can get all the oxygen they need at that point. Well, when the baby is not crying, that is when you start seeing the midwife or the doctor run around to stimulate the baby so that the baby can start responding, because they need oxygen as fast as possible immediately they are born, before you can be assured that this baby can easily adapt or they are responding to the external environment. All right, this is basically why when you see a baby being born, they normally watch the baby before they cut the cord, and once they saw that the baby is maybe appearing pinkish, is a good sign. But any sign of maybe bluish discoloration of any part in the face or in the hand, they normally try anything they can use to stimulate this baby to respond or adapt to the physical environment. All right, that's why you always see your midwives or your doctor run around when babies are not crying. Okay, thank you.